Thank you very much for your kindness. So today, I'd like to talk about our recent study regarding fatty acid supplemented warming solutions. So, as you know, the cryopreservation technology for human oocyte and embryo has substantially progressed in the last 2 decades. However, a recent publication has reported the actual outcomes of autologous oocyte vitrification. And the survival rate was reported as 78%. Furthermore, a very recent paper reported the clinical outcomes of vitrified warmed autologous oocyte cycles at a single UK center, noting a survival rate of 84%. They also summarized the previous report on oocyte vitrification, which indicates that survival rate ranged from 74 to 84%. So these rates are higher than the competence value, but slightly lower than the benchmark values proposed by Alpha Consensus in 2012, which set the benchmark value at 85%. So although more than 10 years have passed, the survival rate has not reached the benchmark values despite vitrification technique developing over the last decade. Furthermore, recent publications have indicated that oocyte vitrification reduces developmental competence and live birth rate. Additionally, oocyte vitrification impacts the distribution and function of mitochondria, chromosomal segregation, and zona pellucida properties. From this result, we consider that there is a room for improvement in vitrification technique, and some modification to solutions and protocols are necessary to improve the clinical outcomes. So, to devise a strategy, we reconsider the principle of vitrification and warming. So, during vitrification, equilibration of cells with cryoprotectants are necessary to prevent ice crystal formation. So, EASY contains EASY and DMSO as permeable cryoprotectants, which diffuse into the cells. And the next step is BIAS, which has higher concentration of EASY and DMSO, and also contains non-permeable cryoprotectants such as sucrose or trehalose, so resulting in cell volume shrinkage due to dehydration. And similar to EAS, the EASY and the DMSO diffuse into the cell. And the embryo warming process includes 2 critical steps. The first one is removal of permeable cryoprotectant, and second one is rehydration. So at this time, I'm focusing on the first one, the removal of permeable cryoprotectants. And the TS is a liquid with highest concentration of non-permeable cryoprotectant, which expels the cryoprotectant from the cells. And in DS and the WS, the permeable cryoprotectant diffuse out from the cells. So to improve the vitrification outcomes, we have focused on the one of the permeable cryoprotectant, DMSO. So as an amphiphilic molecule, DMSO may influence the lipid droplet in cytoplasm because it can dissolve the lipid during vitrification and warming procedures. Therefore, we previously examined the impact of vitrification on the lipid droplet in mouse oocytes. And this red fluorescence indicates a lipid droplet. And our data shows that vitrification significantly decreases the lipid droplet in ooplasm. So lipid droplets serve as a storage for lipids, such as TZC. And the TZC are broken down into fatty acid and then transported to mitochondria. And through the beta oxidation, so fatty acid can contribute to ATP production and subsequent embryo development. Therefore, we hypothesize that the loss of lipid droplet observed after vitrification may be associated with reduced developmental competence. And we also hypothesize that compensating for lipid droplet could improve embryonic outcomes. So at first, we speculated on the mechanism of how lipid droplet decrease during vitrification and warming. And we hypothesized that the reduction of lipid droplet occurs when the DMSO is removed from the cytoplasm. We also consider that adding fatty acid to warming solution may increase the fatty acid and the lipid droplet in cytoplasm. So we first test whether our hypothesis is correct or not. So we examined whether adding fatty acid to warming solution could restore lipid droplet in mouse oocyte. And our data show that fatty acid supplemented warming solution significantly increased the lipid droplet in cytoplasm. Furthermore, we examined the developmental competence of these oocytes by ICSI. And this solution improves the developmental rate to blastocyst and expanded blastocyst stages compared to the non-supplemented solutions. So these findings suggest that adding fatty acid to warming solution effectively improves the outcomes after oocyte vitrification. We then investigated the effectiveness of fatty acid supplemented solution for embryo warming as well. So we warmed mouse fossil stage embryos with or without fatty acid and subsequently transferred to object. And our data shows that the use of fatty acid supplemented solution significantly improved the pulp rate. Additionally, we warmed bovine fossil stage embryos and found that this solution also increased the developmental rate to blastocyst formation and expanded blastocyst expansion. So these results demonstrate that fatty acid supplemented solutions are effective for embryo warming. So our next question was, are the fatty acid supplemented warming solution effective for human embryos? So to answer this question, we did some experiments. So this slide presents the outline of in vitro experiments using human cleavage stage embryos. These embryos were vitrified at the fossil stage on day 2. Then, these embryos were randomly assigned to 2 groups. One group was warmed with fatty acid supplemented solution, while the other group were warmed with non-supplemented solution. And so we cultured them for 72 hours to assess developmental competence, and additionally, to evaluate blastocyst adhesion and outgrowth. The blastocysts were plated on fibronectin-coated dishes after the pellucid removal. So this graph demonstrates the developmental rate. And the developmental rate to expanded blastocyst stages tended to be higher in the fatty acid supplemented group. However, there was no significant difference. On the other hand, the morphological quality of blastocyst was significantly improved in the fatty acid supplemented solution group. We also examined the embryonic morphokinetics during cleavage, compaction, and blastulation, and the developmental speed to each stage were comparable between the groups. Furthermore, the incidence of direct cleavage and reverse cleavage, and the fragmentation degree and the compaction pattern were comparable between the groups. So this slide shows the outgrowth outcomes. The left graph demonstrates the adhesion rate, and that there are no significant difference between the groups. However, outgrowth area was significantly increased in the fatty acid supplemented groups. So these results suggest that fatty acid supplemented solution may improve the pregnancy outcomes after frozen cleavage stage embryo transfers. So we then compare the pregnancy outcomes after frozen cleavage stage embryo transfers between fatty acid supplemented group and the non-supplemented groups. And the characteristics of patient, cycled, and embryos were comparable between the groups. And our data shows that the rate of implantation, critical pregnancy, ongoing pregnancy, and rebirth was significantly improved by using fatty acid supplemented warming solutions. The rebirth rate was increased by 7%, using fatty acid supplemented solutions. Additionally, the incidence of pregnancy complication and perinatal outcomes were similar between the groups. So our data demonstrates the effectiveness and safety of the fatty acid supplemented solutions. We then assess the effectiveness of this solution for blastocyst warming. So we first performed the in vitro experiment using human discarded blastocysts, and the vitrified blastocysts are warmed with or without fatty acid. And this slide shows the result of a lipid droplet staining. And similar to oocyte, the lipid droplet in blastocyst can be restored by using fatty acid supplemented solutions. We then evaluated the blastocyst adhesion and the trophoblast migration ability using in vitro outgrowth model again. And the blastocysts were plated on fibronectin-coated dishes following the ZP removal and the culture for 96 hours. The adhesion rate, outgrowth area, and outgrowth degeneration rate were analyzed. And the embryos were classified as degenerated when the outgrowth area decreased by more than 10% compared to the maximum outgrowth area. The left graph shows the adhesion rate, so there are no significant difference in the adhesion rate between the groups. However, outgrowth area was significantly increased in the fatty acid supplemented groups, and also outgrowth degeneration rate was decreased in fatty acid supplemented groups. Additionally, the proportion of apoptotic cells in outer layer of trophoblast cells was significantly lower in the fatty acid supplemented group than in the control groups, suggesting that the fatty acid supplementation may restore lipid droplet and prevent the shortages of energy sources at the later stage of outgrowth culturing, reducing the apoptosis in trophoblast cells and subsequent outgrowth degeneration. We then compare the pregnancy outcomes after frozen blastocyst transfers between the fatty acid supplemented group and the non-supplemented groups, and the characteristics of patient cycles and embryos were comparable between the groups. And our data demonstrated that this solution can improve the pregnancy outcomes. The live birth rate was increased by 4% in the fatty acid supplemented group. So as I mentioned earlier, fatty acid contribute to ATP production through beta oxidation, so mitochondrial metabolism. So that means the efficacy of fatty acid supplemented solution may depend on the mitochondrial function. So in fact, good prognosis blastocysts have a high mitochondrial potential. However, poor prognosis blastocysts have a low potential. So therefore, it is hypothesized that fatty acid supplemented solutions are more effective for the good prognosis blastocysts. So to confirm this hypothesis, we performed a subgroup analysis. The mitochondrial potential depends on the maternal age. Therefore, we first divide the cohort by maternal age median. So when the patient were younger than 38 years, the fatty acid supplemented warming solution improved the clinical pregnancy, ongoing pregnancy, and live birth rate, and also decreased early pregnancy loss. However, when the patient were 38 years or older, the pregnancy outcomes were comparable between the groups. The mitochondrial potential also depends on the blastocyst quality. Therefore, we then divide the cohort by blastocyst morphology. So we classify the blastocyst with the Gardner's criteria AA, AB, BA, and BB as good quality. And the blastocysts are morphologically good. So when fatty acid supplemented solution improved the live birth rate and reduced the early pregnancy loss. However, when the blastocysts were poor, pregnancy outcomes were comparable between the groups. So these results suggest that fatty acid supplemented solutions are effective, especially for the good prognosis blastocysts. So, taken together, our data demonstrates that vitrification decreases the lipid droplet in the cytoplasm. However, adding fatty acid to warming solution can offset this effect. Additionally, these solutions improve pregnancy outcomes without any adverse effect on maternal and perinatal outcomes. Therefore, we consider that the use of fatty acid supplemented warming solution is an effective option for enhancing clinical outcomes. So this is my last slide. So this is a Kitazato booth lecture. So I should promote their product. So ET526 is a fatty acid supplemented warming solution kit, and this is a sole validated commercial product demonstrating the capacity to recover lipid droplet in cytoplasm and improve pregnancy outcomes through the incorporation of fatty acid into the warming solutions. And the fatty acid utilized in this product are chemically defined, thereby guaranteeing the consistency of product quality. And this product is already available in several countries, including Japan, and will be available in your country in a few years. So thank you very much.